Dr. Tom Roselle live right now. 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. We are in studio on this finally sunshine Washington day. Well, maybe we'll see what happens. Give us a call at 888-630-WMAL. That's 888-630-9625. You're listening to us on 105.9 FM and AM 630 WMAL. We're here to answer all kinds of questions from a natural point of view. Perhaps you've had a problem, you've tried, you've applied, you've come up with, something that doesn't work. Well, let's put it in a position where something that might work, that can change your life and put you back into a place where your body was designed to be healthy and well. We're going to be talking about a very interesting subject, something that many of you suffer from, particularly if you're female. However, it does affect men as well. And what we're talking about is a condition that makes you feel lousy, lets you put on weight, takes away your energy and your mental capacity, your skin gets dry, intestinal system doesn't work, and it goes on, from brittle nails to dry hair to irritability, intolerance to heat or cold, mostly cold, and it goes from there. But to help me talk to you about that, to help you discuss it, I have a very special guest, somebody who has a very keen interest in hypothyroidism, is what we're talking about, Dr. Leonard Poe. Good afternoon, Dr. Poe.
Good afternoon.
So, here's the deal. We've got a condition called hypothyroidism, and everybody knows we're a practice that looks at things without drugs and without surgery, and we look at from a why is that point of view, because there isn't a condition that exists that doesn't have a reason why it started, and when you can understand the reason, you get to understand what to do about it and fix it, sometimes permanently, and usually permanently, without drugs. Kind of an interesting concept. So what we're going to do is this Wednesday evening, you're going to be doing a presentation. You're going to be our in-house presenter, our continuing education program at the Roselle Center for Healing. You're going to be talking about hypothyroidism and actually thyroid conditions in general, and Hashimoto's thyroiditis, which is an autoimmune problem. And for those of you who'd like to attend, you can give us a call at 703-698-7117. But today we're going to answer questions. So let's start with the incidence and the propensity, and is this something that's just a flash in the pan, or do we really have a lot of people that need to be worrying about their thyroid and their thyroid problems?
No, there's a lot of people out there that have thyroid problems. A lot of it goes undiagnosed for a very long time. But the big piece of it, and the thing that we always talk about is and you mentioned earlier, is the mechanisms behind it. It's not something, the full mechanism of why the thyroid's not working the way it's working is never really looked at.
So when a patient goes to the doctor and the doctor does their annual physical and we see the results come back and, we have blood counts and we have SMAC panels, means that we see 14, 15, 16, 21 chemistries. And then they'll run lipids, which are your blood fats, and generally then they'll run a thyroid test. And the patient will say, well, my doc said I'm fine, but they've run basically two tests if they're
lucky. That's the key thing. It's a test.
That's right. Sometimes it's one. If we're lucky, it's two. But they'll run what? Thyroid-stimulating hormone, and they'll run thyroxine, T4.
Right.
But that's not even the beginning of the story. That's just like saying, well, we got a thyroid problem, maybe.
No, and the point of running those things is for pharmacological intervention, and that's it, so you can get a drug. But it doesn't really address why the thyroid might not be working well, and really, the sad part about it is the drugs really don't the drugs really don't do anything to help you with the real problems behind thyroid function. It just helps to level out some of those blood tests so they look good on paper, and that's really about it.
Well, let's talk about it a little bit. We have a lot of different markers for thyroid function that are necessary to properly diagnose a thyroid condition. Unfortunately, we don't get a lot of them when we look at a patient's lab work. We have to order them specially. And TSH is the most common one that's ordered, thyroid-stimulating hormone, which is released from the pituitary.
Yeah, it's not a thyroid hormone.
No, not at all. It's pituitary hormone. And then the next measure is thyroxine, which is T4. And the medication when T4 is low is Synthroid. But there's a whole downstream effect that really, because, for example, a patient comes in, their doctor says, well, my TSH level is normal. Well, the laboratory ranges are like 0.57 up to 4.5. And as long as they're within that range, the physician says everything's cool. textbook normal is 1.8 to 2.2. So when we look at an upshift or downshift, most physicians say there's nothing wrong as long as they're in that marker, but they present with every other symptom of thyroid conditions. Why?
Oh, there's lots
big
of different
question.
Yeah, it's a big question. There's lots of different reasons why. You can get, one of the real common pieces is you can get the same sort of thing that you get with insulin sensitivity, where the cells just aren't taking in the actual thyroid hormone. But if you're just running TSH and T4, you're not even running any levels to check to see what the actual active hormone is, which is T3, then you won't even see that. So there's no way to tell, well, is it even getting in the cell and doing what it's supposed to do?
And there are a lot of patients who say, T what? 3?
And there's another one.
Yeah, there's another one. There's actually T1 and T2, but that's a horse of a different story as well. But T3 is the active hormone. It's the one that gets into the cells. But 80% of T4, thyroxine, has to be converted to T3.
Right.
And that occurs in the
liver.
In the liver.
So if liver is inflamed, if it's not functioning correctly, if you have high cortisol levels because of stress, that's going to block the conversion of it. So you might have plenty of T4, so the lab test looks good. T4 is okay, TSH is okay, but you're not making any active hormone. You're not converting any real active hormone. It's not getting into the cell, and you're losing your basic metabolism. All the cells in the body have thyroid receptors. There's not one that doesn't. And it's really the thyroid that governs metabolism at that cellular level. So if the hormone's not getting in there, we've got a problem. And then when you talk about, when you talk about hypothyroidism, you've got to pull in Hashimoto's as well, which is the autoimmune portion of it.
Autoimmune inflammatory condition.
And what you see a lot of times when you look at blood, I looked at it and it was fine. With autoimmune diseases like that, you're going to have flare-ups. You're going to see if you were to go back and measure blood on a monthly basis, you're going to see those TSH levels going up and down and up and down. And a lot of times when we're reading those blood values, it happens to be in a range that's somewhat acceptable, but that's not really a true view of what's going on historically. And that's a whole other problem.
You have to look at what the hormone does in its downstream conversion and ultimately its availability to the tissue sites. When we have resistance patterns within the body, we often talk about insulin resistance relative to diabetes, but there's hormone resistant everything. It can, in this situation, we're talking about thyroid hormone resistance, the active hormone being T3. The markers that we need to look at, if you really want to understand whether T3 is working or not, is you need to look at total T3, the total amount of conversion that's taking place. You need to look at the available amount of T3 that will actually get in from the mucous linings, and that's free T3. And then you need to know what's being taken actually into the cell. That's called uptake. And we never see those. And then there's this one other little bugger out there that is totally missed, and that's reverse T3, and that shuts down the production of T3. So there's a story to be told, and we're not even into thyroid antibodies, and we're not even into talking about adrenal and the upregulatory hypothalamus pituitary adrenal axis.
All the many different parts that will shut down thyroid production or alter it, whether we're talking about estrogen, testosterone imbalances, we're talking about neurotransmitter imbalances, we're talking about adrenal function, blood sugar handling. There's many, many things that will go into creating this cycle of thyroid function just not being there, not being where it should be.
So it's not as easy as going and say, well, my T4 is low or my TSH is down, and here, take the Synthroid, and we'll check it out in 6 months.
No, unfortunately, it's a lot more complicated than that. We're going to make it as easy as we can on Wednesday to really kind of unravel this whole mess and make it really clear. But the thyroid is a complicated system, and it's not something that can be explained in 3 minutes. It's not something that can be treated in 3 minutes. It's much more involved, and it factors into a lot more body systems than simply, well, let's give you something to help modulate that TSH and call it a day. Because the sad truth is, most people, they go on something like Synthroid or one of the many other alternatives to it, they still feel the same. Because it's not affecting all the downstream. You're still not getting any more of the active hormone in the cells than you were before.
No, it's not being converted. Even the synthetic T4 has to be converted. A lot of physicians will put people on natural hormone, as they say, Armour or something of that nature. And the reason that there's a better effect is because there's some T3 in it already. Levoxyl is the synthetic form. However, to really understand why the system is shutting down, allow your body to work properly so you don't have all the symptoms of, the swelling, the weight gain, the memory lapses, the brittle hair, the brittle skin, the rough elbows, the rough heels, and so forth, and we can go on and on and on. The profound fatigue that just never seems to go away. You have to look at it from a different aspect, of a different point of view. Talk to us a little bit about, and this is an area that intrigues me and most people don't understand, is the intestinal tract and how that intestinal system is interrelated to thyroid function. People say, "What? My intestinal tract? What are you talking about?" Well,
when the liver converts T4, it's going to convert it into a couple different things. It's going to convert it into T3, which is your main active hormone. It's going to convert it into T3 acetic acid, and then something else called T3 sulfate. And that T3 sulfate can then get reconverted back into active T3, but only if the gut is working properly. That's where we get another portion of our T3 from at the end of the day, but only if the gut is healthy. If we've got, and lots and lots, we could have a whole other program on just gut function. We could have a year's worth of programming on gut function.
No kidding.
If there's candida in there, if there's mold, fungus, bacteria, parasites, any kind of pathogens in there, if you're just filling it with just garbage from the diet, it's inflamed, it's agitated, it's permeable, you don't have good bowel flora, you've got dysbiosis, you're not going to convert, and you're going to lose out on more of your T3. You're just not going to have it available for you.
T3 is the one that really nobody talks about unless you've done your homework. And the interesting thing is that there's more patients today that have a greater insight than most physicians do. Physicians, unfortunately, and this is not 100% across the board because there's some great docs out there. There's some really excellent functional medicine people, but there are, they don't take the time, other than what the pharmaceutical companies tell them about when you need to supplement the drug, about what really happens downstream, and to really help your patient. Patient will come in and I'll tell them that, they have a thyroid problem, and they say, well, my doctor said, and I go through and I sit down, I flip the paper over and I take them through, it has to convert to this and this. But one of the most effective ways of telling whether or not you have a thyroid problem is an old-fashioned test with a thermometer. Is you take your first morning temperature underneath your armpit, and you record that on a daily basis for 7 to 10 days, and your temperature should be 97.8 to 98.2, because your temperature underneath your arm is usually about a degree lower than what it is in your mouth. So when you do that and you're seeing a consistency lower threshold, guess what you got? You got a thyroid problem, and you have to deal with it. So we have a few more seconds, but what are the other systems that we're going to talk about today, and you're going to talk about Wednesday night, that has to do with thyroid problems? You got 30 seconds to list them.
Yeah, to list all of them. Okay, real quick, we're going to talk about neurotransmitters, specifically dopamine, serotonin. We're going to talk about blood sugar handling and different types of dysglycemia, how it plays a role, estrogen, testosterone imbalances, adrenal function, cortisol. We talked about the gut a little bit.
Yep.
There's a few more.
Pituitary, hypothalamus.
That's right. This is not, we talk about holistic care all the time, but this is not a standalone system.
No, not.
This is integrated in lots and lots of different parts of the body.
So don't go away. We're going to be listening to Dr. Poe for the rest of the show, talk about thyroid problems. This is Dr. Tom Roselle.
Now you can hear us everywhere, all day, all night. 105.9 FM and AM 630. WMAL. Dr. Tom Roselle Live continues now. 105.9 FM and AM 630. WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, broadcasting to you from 105.9 FM and AM 630 WMAL. Love to talk to you today on any subject that you have in mind. We're talking about thyroid problems, and my guest in studio, Dr. Leonard Poe, who will be your host this Wednesday evening, October the 5th at 7:30 p.m. at the Roselle Center for Healing. We're located on Arlington Boulevard, Route 50 in Fairfax, actually just about a quarter of a mile or less off the National Capital Beltway. Please be our guest. We would love to host you and give you as much information as we possibly can. These lectures are a gift to the community, but we do require a reservation, so give us a call at 703-683-5555. 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend this Wednesday night's presentation, and I promise you it'll be worth your while. You will go away with information and an understanding that you didn't have before. But before we get back into thyroid problems, let's go to the phones. Greg, how can I help you? Thank you for calling, sir.
Oh, hello, doctors. It's a pleasure to talk to you. FM is great.
It is indeed.
I want to let you know, my mother has suffered from ulcers for about 20 years, and fortunately, listening to radio shows like yourself, she did find another doctor who knew about Dr. Marshall's research in Australia. So she was about a week before she was going to have stomach surgery, and he called her into the office. He had her tested, and he said that she was 33 times normal with the Helicobacter pylori infection, and he gave her 3 antibiotics and an antacid, and he told her to take the pills, and I have to say within 1 week she was fully cured. She went back for her blood test, and her bacteria level was back to normal.
Yeah, the most common cause of duodenal and stomach ulcers is Helicobacter.
Yeah.
So is it a question or is it a statement?
Well, I just want to say shows like yours are great information, because a lot of people suffer from ulcers without having that Helicobacter test. And my mother did come, and her sister, from Southern Europe in Sparta, Greece, and the doctor, who was also a researcher, said people from the Mediterranean should check for that first, because they have a tendency to get that infection more often than other people.
That's true, but also the fact that is a very, very prominent condition here in the United States. One of the things that she needs to do to encourage the repair process of the tissue, not only getting rid of it and beginning to stop the painful aspect of the ulcer, but using a food-grade aloe, A-L-O-E, aloe juice, and I would do 2 ounces a day for about better part of a month or so. Greg, I appreciate your comments, and thank you for your call. Stomach ulcers are one of those things that can obviously destroy a person's health, and it's necessary, it's important that you complete the loop and you complete the cycle in taking care of that. Helicobacter, and there's some other bacteria as well that have to be identified. There's some testing that you do that is very specific, very straight up. Again, unfortunately, not a lot of physicians are up to tune on it and do it on a routine basis.
50% of the population worldwide.
That's right. That's the actual incidence.
For H. pylori.
It's huge. It's huge. It's not just Mediterranean folks. It's all over the world.
Yeah, the testing is important for that, because there's different types.
Dr. Poe.
Yes.
Talk to us a little bit more about thyroid function problems. Meaning this. How, subclinically, how would a person know or suspect that they have a thyroid problem?
One of the easiest ways is fatigue. And, of course, that can be a lot of different things, but fatigue is usually one of the starting points with it, because it hurts your metabolism at the basic cell level. So that's one thing. Hair loss is another one. Brittle nails, the cold, more so than not, cold fingertips, cold nose. You're just not getting perfusion of the extremities. Those are real easy pieces to kind of start to think, maybe there's a problem here with thyroid.
Diagnostically, you take a look at a patient, you look at their face, and the
weight gain, missed that one.
Well, the weight gain, absolutely. Yeah. But take a look at their eyebrows. The outer 1/3 of the eyebrow, if it's very thin compared to the rest of the eyebrow, or it's missing altogether, it is almost totally 100% indicative of a thyroid function problem. Then you go to the elbows and you run your hands against it. If the elbows are rough and scaly, another indicator. The heels, the same thing. Low body temperature, again. So you start adding those things up.
Menstrual disruptions are another one.
For women, absolutely. Very, very significant. It's one of those things that, we miss continually, and you have to look at them very, very specific.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are here on 105.9 FM and AM 630 WMAL. Love to talk to you on any subject you have in mind. You can do that by calling us here at 888-630-9625. That's 888-630-9625. WMAL, love to talk to you no matter what the topic is. We're talking about thyroid problems and how it affects your body, and we know many of you are on thyroid medication, and unfortunately needlessly in some situations, because you can do something about it. You can change it. My guest in studio, Dr. Leonard Poe, who will be your host this Wednesday evening, October the 5th at the Roselle Center for Healing. If you'd like to attend his lecture at 7:30 p.m., give our office a call at 703-698-7117. That's 703-698-7117. Let's go to the phones. Linda, thank you for holding. How can I help you?
Oh, hi, Dr. Roselle. I had a question about my mom, who is 78 years old. Back in April, she had a vomiting episode where it lasted a couple of days, and the third day we got her to the hospital, and she was diagnosed with gallstones, and doctor was ready to do surgery, but she is not. She doesn't handle anesthesia very well, so she's very, very reluctant to even think about surgery. So a month ago, she's had issues with a sharp pain on the right side where the gallbladder is, and then yesterday she also had some more sharp pains, and my sister said she looks jaundiced now. So we're wondering, is there a way for us to prevent this from getting worse and prevent future gall attacks, and what we can do to help her?
Linda, the fact that she's getting jaundice is indicating that it's affecting the liver.
Right.
And so the liver's backing up, and you're getting liver enzymes that are starting to rise in the body. Not a good thing, obviously. Mm-hmm. So the short answer is yes. What you have to be careful with in this situation is a raging infection that, if it gets out of control, then there's a problem. It doesn't sound like it. Sounds like an obstruction. So there are things that can be done, but your mother's going to have to take some immediate action, and it's going to include dietary intervention. There's nutritional and herbal supplementation that works, acupuncture, low-energy light laser. We've seen, in my career, 35 years, I've seen thousands of these. And there are some that they get to the brink. There's nothing they can do except for surgery, but she's not there yet. But if she continues to play with it and doesn't make some hard decisions, let me give you a checklist. First, one of the things that cause gallbladder problems for everybody are things that people are allergic to, particularly glutens. Any of the wheats and wheat, rye, barley, oats, and so forth. You got to get her off of those. She has to begin to soften the stones and begin to gently flush. Organic apple juice is useful. There's a flushing process, but I don't know your mom's state of health. I don't know much about her, so I'm reticent to tell you how to do that without knowing a whole lot more about her medically. So you have to look at all of the pieces of the puzzle and then begin to act on those things. I'll be more than happy to, if you're not near us, to refer you. You get a hold of me through our website, rosellecare.com, and give me a little bit more. But the short answer is yes. There's much that can be done. Digestive enzymes, proteolytic enzymes, and so forth will also begin to help soften those stones up. Disodium phosphate is a product that we use that will also begin to soften it. So I can go on, but the answer is yes. There's a lot that can be done.
Okay, great. Thank you so much.
You're more than welcome.
You just mentioned gluten.
Yes, I did.
You want to talk about that for a minute?
Let's jump right into it.
With gluten, especially since we're talking about thyroid today, across the board, if you've got thyroid problems, you've probably got a gluten problem. Diseases like Hashimoto's disease, which is the autoimmune of the thyroid, it's the same gene as gluten allergies are. So it's 100% of the time, if you've got problems with one or the other, you're going to have the other one.
In my clinical experience, you're exactly right. And if you don't eliminate them and watch the foods that you eat that has gluten in it, because they use gluten and gluten products all the time. In addition to that, you were talking about Hashimoto's problem. The average now autoimmune reactions to thyroid is somewhere in the neighborhood up to 38 to 40% of all the patients that walk into anybody's office has a underlying Hashimoto's thyroiditis.
It's probably higher than that. We're finding autoimmune in more and more people today.
And it's because of our lifestyles, our choices, our exposures, the things that we're putting in our bodies.
It's a lot of we're losing chemical tolerance, and that's leading into a loss of self-tolerance.
And this goes down to the basics. It goes to the intestinal tract, and it goes to liver function.
The sad fact is that this is just straightforward statistics. If you have hypothyroidism, 90% of the time, that's going to be Hashimoto's. That's actually going to be autoimmune.
That's a huge, and there's some people out there that are sitting there. How can they say things like, well, that's the data that's out there. It's not our data.
That's just statistics.
it's more and more evident as time goes on. As a society, the exposures that we have, the xenoestrogens, the plastics, the runoffs, the preservatives, all that stuff. And now what's becoming even worse is the overuse of halides in preservation of foods. We're seeing, it used to be that they would stabilize and put things like iodine in wheat. Well, they don't do that anymore. Now they're putting bromides in. And what happens is it competes in the body and blocks the absorption of all kinds of hormones, but particularly thyroid hormones. So when you're getting vegetables that are non-organic, you're getting foods that have been sprayed, you're getting foods that have been preserved in some way, you're causing your body tremendous amounts of deterioration and depletion. And it goes on. So when we talk about thyroid problems, Dr. Poe, there's, what is a patient, what are they supposed to do? How can they begin to really understand the mechanisms that are involved here? Well, because they're being taught something totally different.
Yeah, and that would start with coming by Wednesday probably and looking at the whole picture here, because that's you've got to see the whole picture of it. But you have to really differentiate, because the statistics are so high. Is this really a thyroid problem, or is this an immune problem? Is this an autoimmune issue? Because they have to be treated very differently if you want to try to maintain the organ for any kind of longevity. If you want to actually heal the system and keep it from jumping into more autoimmune types of diseases, you've got to go after the immune system.
And here's a situation that a lot of people don't know about, is if they're taking artificial medication, Synthroid, they are actually causing their body a problem. There's going to be a long-term reaction that takes effect that their physicians aren't telling them about, and one of these things is the progression to Hashimoto's thyroiditis. Let's go to the phones. Diane, how can I help you?
I'm calling about my 76-year-old mother. In the past few years, she's developed nystagmus and dizziness and problems walking. Different doctors have suggested muscle tightness and neuropathy and constricted veins in her head. And she also feels the pressure when she's sitting. She feels it in her head. She does have degenerative discs in her lumbar. But she's had a recent brain CT, and it does show that the ventricles are mildly prominent. And it also shows a mild supratentorial periventricular leukomalacia. But there's no hemorrhage and no abnormalities seen. So in looking all this up on the web, I'm wondering if the problems could be caused by her current problems of nystagmus and dizziness and walking could be caused by the CSF not moving through her brain properly or too much pressure in her brain?
It's possible. Diane, listen, so what you have to look at, basically you have a negative CT scan. It's not telling you much of anything. There's really no evidence there. When you look at spinal fluid motion, you have to look at the cranial mechanism, the plates of the skull, and how they're moving or if they're not moving. And the plates of the skull expand and contract in reciprocation to inhalation and exhalation. Underneath the skull bones, you have this hard dura, this saran wrap like substance that's stuck to the skull bones and comes down, wraps all the way around, and then goes all the way down to the spine and then attaches to the sacrum. And as you breathe in and out, the skull bones expand and contract. The sacrum, that wedge-shaped bone in your pelvis, moves back and forward and moves the spinal fluid up and down. So you can have a lot of things that are causing that, from a misalignment of the upper vertebrae of the neck, particularly C1 and C2. You can have a cranial problem. You can have a TMJ, a temporomandibular joint problem that's initiating a lot of this. You can have a pelvic sacral problem. But as long as there's no pathology in the brain, then it tells you that it could be functional, it could be structural. Now, the other piece that you have to look at is the functional capacity of the adrenal glands. Because if the adrenal glands aren't working the way they should be, there's a hormone called angiotensin. It maintains blood pressure regulation, and if the blood pressure is maintained in its arterial system the way it's supposed to, when you change positions, if you get up too quickly, you're going to get dizzy.
She does.
That's adrenal.
She's got very low blood pressure.
That's hypoadrenia, proven otherwise. I mean, there can be other mechanisms that are involved here, but that is typically how that reacts. So you put all the pieces together, and at your mother's age, there's a lot of depletion. You would look at the acupuncture system, particularly the energy to the kidney, and you begin to treat accordingly. But that's a thumbnail. So if we can help you in any way, if you'd like to go back and forth with me, get a hold of me through our website at rosellecare.com. I'd be delighted to do that with you, and if I can give you more information, please ask. Typical.
Very typical.
We see it all the time. And one of the things also is thyroid function that can cause that as well. A woman that age could very likely have some thyroid problems, but my knee-jerk goes to structural alignment, upper cervical problems. It goes to adrenal hypofunction. It goes to kidney function. And you rule in and out those things, and you treat accordingly. And I know you're going to get into the thyroid relation to that this Wednesday evening. Let's go to the phones. James, thank you for calling. How can we help you, sir?
Hey, hi, doctors. I just had a question about with the thyroid. Most of the time when I hear it discussed with problems, it's mostly women, but do men have it too? Because I've had depression pretty much my whole life, but I have the really dry skin and the brittle hair and stuff, and the really low energy. But I've been probably had like 3 tests on thyroid, but it's always been the basic tests you're talking about. They never really.
Yeah, well, there's a reason that they don't show up, but in fact, the answer is yes.
Yeah, absolutely can be. And once again, you got to weed out: is it really within a functional range, or is it within that pathological range? And those numbers are very different. But it's interesting that you mention along with that some history of depression that goes along with it. What really jumpstarts the thyroid from a hypothalamic pituitary standpoint and gets it moving is serotonin and dopamine. This is the neurotransmitter pathways in the brain. On the tail end of it, it's actually serotonin and dopamine that sensitize the cells to receive and become sensitive to thyroid hormone itself. And it's a pattern that you often see go together. Often depression will accompany it. And that really begs the question, well, which one is it? Is it a problem with the thyroid gland itself, or is it a problem with serotonin and dopamine in the brain, and it's not kickstarting that pathway? So those are very common, and men can have thyroid problems just the same way women can. The ratios aren't as high, but nonetheless, I have plenty of male patients that are hypothyroid, and I have male patients that have Hashimoto. This is not solely a female disease.
And when you see a male with thyroid problems, they usually have other hormone imbalances as well.
And then we're looking at testosterone and estrogen imbalances in there, yeah.
The brain, the pituitary that produces TSH, thyroid-stimulating hormone, to stimulate the thyroid, also produces something called LH, luteinizing hormone. And in men, it stimulates the testicles to produce testosterone. And so they both can be affected. And then if you have an inflammatory reaction in the body, even if you're producing some of it, you can't absorb it, and then you end up with the problems that are associated with that. Hope that's helpful, James. Thank you for calling. I appreciate it. This Wednesday evening, Dr. Leonard Poe will be your host at the Roselle Center for Healing at 7:30 p.m., October the 5th. And he's going to be talking about thyroid problems and all the ramifications thereof. So if you'd like to attend that presentation, give us a call at 703-698-7117. We're very easily found right off the National Capital Beltway on Route 50 on Arlington Boulevard. About a quarter of a mile, we're in the Red Cross building. So this is our gift to you. We'd love to have you as our guest, but the only thing that we require is a reservation, so give us a call. You're going to be talking about some very interesting things. I had a thyroid problem as a child, and my mother had one, and there was a genetic predisposition. But in my particular situation, I have a left lower lobe of the thyroid that is missing. In those days, they did crazy things like do thyroid uptakes with iodine, radioactive iodine, and so forth.
Because if you didn't have a problem before,
you got one now. And, as a result, there's cyst formations. But here I am after all these years. I don't take any medication. My thyroid works very well.
WMAL FM Woodbridge, Washington.
WMAL Washington.
WRQX HD2 Washington. Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. You're listening to Dr. Tom Roselle Live, and just a hello to all of you new listeners because of 105.9 FM. Love to have you here, and hopefully you'll enjoy Dr. Tom Roselle Live every Sunday at 12 noon. Want to remind you, an ongoing sponsor of Dr. Tom Roselle Live is Thermography Centers of Fairfax. You can go to thermographycenters.com and check them out. Two very excellent thermographers, Dareth Painter in Virginia and Tammy Liner, who sets up all the other centers out in Maryland and West Virginia and Pennsylvania. But if you'd like to make an appointment, if you'd like more information, go online to thermographycenters.com and you can get a hold of them. The number's there, 888-485-7736. And as for Dareth Painter, Dareth will get back to you and talk to you and let you know what you need to do. However, you need to make thermographic imaging part of your annual diagnostic and examination process. This Wednesday evening in our office, October 5th, my guest in studio, Dr. Leonard Poe, will be your host in our in-house continuing education program. He's going to be talking about thyroid problems and what they are and how you can fix them and how you can get off the medications, the drugs, the effect, some of the things that you may not know about it. Very, very powerful evening. 703-698-7117. That's how you register for that class. Meantime, let's go to the phones. Diane, how can we help you? Diane? Hello, Diane? I don't think Diane's there. Anyway, Diane had a question on C. diff, I think, so if you're there and we still have time, more than happy to talk to you, Diane. Dr. Poe, wrap it up for us. Tell us what you're going to be talking about Wednesday evening and why people should come and listen to you.
We're going to go through the whole cycle of thyroid and how it works, how the hormones are produced, where they go, where they're converted, how they get in the cells. There's a big difference between just treating it with Synthroid or one of the generics that go along with that and actually getting the thyroid hormone to work for you and actually starting to change your health and change your life. We're going to break it up a little bit. We're going to talk because if we're talking about hypothyroid, we're going to have to talk about autoimmune and Hashimoto's as well. I diagnose patients on almost a weekly basis with some sort of Hashimoto's. It's common. It's out there. You need to be aware of it. And you're going to really need to understand what you can do to keep the flare-ups down and keep it from destroying the thyroid any more than it already is. But I really want to go through and explain how the whole thyroid cycle works. It's so important to really understand that and really understand why just taking Synthroid or just taking the medication isn't going to do it for you.
Actually, it progresses. It gets worse over time.
It will.
If you don't address the why is that, as we've talked about for so many years, you have a condition that is being symptomatically blunted, but nothing is being solved to restore normal functional capacity of the body. And that's criminal. You have to really understand it. You have to turn the lights back on in the house and make sure things are working the way they're supposed to. This Wednesday evening, Dr. Leonard Poe will be your host. Give us a call, 703-698-7117. Check us out online at rosellecare.com. We'll be here next week at 12 noon. Give us a call. See you then. Bye. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, rosellecare.com. That's rosellecare.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.